So, good morning everyone. Today we are going to see organ function test overview. So, what are the organ function tests? So, organ function tests are a set of tests which are useful to assess the functioning of a particular organ, or it will be useful for the diagnosis of any disease of that particular organ. And of course, it will be useful to assess the normal function and also the any damage to the organ. So only a set of tests which are necessary to assess the function of a particular organ are known as organ function tests. So there are different function tests for different organs. So today we are going to see the overview of the function tests, because most of the function tests we had already finished in the previous sessions. So organ function tests are set of tests carried out to assess the normal functioning of a particular organ. It is useful in diagnosis of diseases or to assess damage to an organ. We know organs will be having different functions. So different functional aspects is assessed by different tests. So all these tests are commonly known as organ function tests. So the general indications for different organ tests are: functioning of organ is normal or not, to check the functioning, and suspecting any diseases or any symptom related to a disease of that particular organ, and screening of a disease, assess severity and prognosis of a disease, and follow up of course of disease. Okay, so in general, to assess the functioning of an organ, we can send the patient for the organ test, or if there is any symptom to the patient which is related to a particular system or a particular organ, or if we suspect any disease to the patient, then we can send to the patient for the organ function test. And screening means a set of people are screened for a disease, whether they are having that disease or not. For example, in a company, if there are 500 employees, then we will screen all the employees, the fasting blood sugar or the random blood sugar, to see whether they are having diabetes or not. So screening means examining a set of people to see whether how many are having a particular disease. So in case of screening also, screening of the liver diseases and screening of the kidney diseases, the liver function test can be, the organ function test can be done. And assess severity and prognosis of a disease. Even after the diagnosis of the diseases also, we can see how severely it is affected, the disease or the organ, how severely it is affected, and to see the prognosis of the disease. Now, what is the outcome of the disease, we can assess by organ function test. And also follow up of course of disease. So after diagnosing of the disease, we will give the treatment to the patient. So even after giving the treatment also, we can again send the patient to the organ function test to see how better he is improving, how is the treatment, how is the course of the disease. To see all these things also, we can send the patient for the organ function test, any of the organ function tests depending upon the disease. So these are the generalized indications for sending a patient to undergo organ function tests. So the important organ function tests which we will be dealing with in the daily practice are liver function test, renal function test, gastric function test, pancreatic function test, and thyroid function test. Because most of the common diseases are associated with these organs, so that's why these function tests are commonly done in routine practice. So we'll see the overview, because we had already completed the most of the function tests in detail. So today we are going in a brief way. So before, first we are going to see liver function test. So before seeing any organ function test, we have to first know the anatomy and the physiology. That means the structure and the functions of the particular organ. So we had already seen this is the liver. So in liver we know that we are having lobes, and there will be cystic duct, hepatic duct, and it will be having nerve supply and arterial supply, all those things. Coming to the functions of liver. What are the functions of liver? Metabolic function, excretory function, detoxification function, hematological function, storage function, and synthetic function. So different organs will be having a number of functions. So each function is assessed by a single test or a number of tests. So all these tests are combined to form a set of tests. So that is organ functions. So coming to the metabolic function, we know the carbohydrate metabolism, lipid metabolism, and amino acid metabolism mostly depends on the liver, because we know most of the metabolisms take place in the liver. So liver is the site for a number of metabolisms that are taking place in the body. So that's why it plays an important role in all the carbohydrate, lipid, and amino acid metabolism. That is a very important function. And the next is excretory function. So we had seen in detail about this excretory function in the previous sessions. So it will excrete the bilirubin in the form of stercobilin and urobilin, stercobilinogen and urobilinogen. And where you will get this bilirubin, the conjugated bilirubin? We will get it from the unconjugated bilirubin, which is conjugate in the liver, and this unconjugated bilirubin will be getting from the hemolysis of the blood cells. So this from heme we will get the all this bilirubin, it is conjugated, becomes unconjugated, becomes conjugated, and is excreted as stercobilinogen, urobilinogen. So this is done by liver. So this is an important function of the liver. So next is the detoxification. So detoxification of different biochemical substance and detoxification of drugs, if taken, all this is very much necessary. So that is done in the liver. And in detoxification, there will be phase 1, phase 2 reactions, the conjugation in phase 2 and the hydrolysis reduction, all those the phase 1. So these all we had already seen. And finally, after detoxification, the less toxic waste products are excreted through feces and urine. So this detoxification is done in the liver. So the detoxification is also very important function of liver. Next is hematological function. The synthesis of different coagulation factors which takes place in the liver. So all these coagulation factors are nothing but they are proteins which are made up of amino acids. So the synthesis of most of this takes place in the liver only. Storage function. And coming to storage, we know the liver is an important organ for the storage of glucose, which is very necessary for us in the daily life. And it stores the glucose in the form of glycogen. Okay, so we all know we'll get the energy by glycolysis, by breakdown of the glucose in each and every cell. So when we take the food, it is digested to the glucose and it is absorbed in the form of glucose, and finally by glycolysis we'll get the energy. And after taking the food for nearly 4 hours, the blood glucose will directly supply the energy for us. Then after 4 hours, after 6 hours, what happens? If we don't take the food, then we know that the glycogen present in the liver undergo glycogenolysis to release the glucose into the blood. And that glucose enters the cells and gives the energy. So liver is a very important organ which stores glucose in the form of glycogen, which is required for our daily activities. And apart from that, the liver also stores different vitamins, especially fat soluble vitamins like A, D, E, K. Okay? And apart from that, it was also stores vitamin B12 and iron and folic acid. Okay, so liver is an important storage organ. also. So coming to the assessment, the liver function test. So we will be assessing the different functions of the liver or any organ. We will be assessing the different functions by different tests. So in case of liver, for assessing the metabolic function, we will be seeing the galactose tolerance test, by which we can assess the carbohydrate metabolism, the serum cholesterol, by which we can assess the lipid metabolism, whether it is occurring normally or not, and protein metabolism can be assessed by estimating serum proteins and amino acids in the urine. So by all these, we can assess the metabolic function of liver. And coming to the excretory function of liver, we know serum bilirubin, urine and fecal urobilinogen, and urine bile salts. So if all these are estimated, we can assess the excretory function of the liver. And we know different methods for estimating these parameters. We had already seen in the practical session also, and we know the even normal values. The serum bilirubin, total bilirubin is 0.2 to 1.2 milligram per deciliter, and direct bilirubin is 0 to 0.4 milligram per deciliter. Similarly, urine bilirubin is generally absent. If it is seen, we can suspect some defect in the excretory function of the liver. Similarly, urobilinogen and urine bile salts. So all the analysis of the different biochemical parameters and the interpretation, all these we had seen in the previous sessions. So test based on detoxification function. So we know phase 1, phase 2 reaction, detoxification, which takes place in the liver. To assess whether the detoxification function is normal or not, we will be doing the hippuric acid test and estimation of blood ammonia. The hippuric acid is an acid released in the detoxification process. So by estimating the hippuric acid, we can assess whether the functioning is normal or not. Similarly, estimation of blood ammonia. We know how we are getting the ammonia. We are getting the ammonia by protein metabolism from different cells from glutamine. And what happens to this ammonia, which is a waste product and a highly toxic product? This highly toxic ammonia is converted to urea in liver only by urea cycle. So this urea cycle takes place in the liver. So when there is any defect in the liver, in the detoxification function of the liver, when there is any defect, then this ammonia can't be converted to urea by urea cycle because the site is liver only. So if the urea cycle, if there is defect in the liver, the detoxification function is affected, the urea cycle is affected, and the ammonia levels will be increased in the blood. So by this, we can tell there is defect in the liver function in the detoxification. And coming to the test based on synthetic function, the synthesis of different plasma proteins takes place in the liver only. Okay, we know different plasma proteins, the albumin, the globulins, alpha, beta globulins, and different examples are there for plasma proteins. So all these are synthesized in liver only. So if we estimate the plasma proteins, then if there is any change in the normal levels of the plasma protein, we can suspect some liver disease. We can suspect from defect in the synthetic function of the liver disease. Similarly, the hematological function, the coagulation factor is in the liver only, so that can be assessed by estimating the prothrombin time. The next is the storage function. It stores the fat soluble vitamins especially. So if we estimate the fat soluble vitamins like A, D, K, and also water soluble like B12, if there are any deficiency, then we can suspect some liver disease. So the deficiency of the vitamins can occur in other conditions also. So it is due to the liver defect or it is due to the other conditions, that is assessed by doing the other relevant investigations. Apart from the liver function test, by doing the other relevant investigations, we can exclude the all other causes of deficiency of ADE. But in case of liver defect also, there may be deficiency of some vitamins. That can be assessed by estimating the vitamins, individual vitamins. So this finished the liver function test briefly, and coming to the renal function test, the kidney function test. We know the kidney, the structure of the kidney, the outer cortex and the medulla, and we know the nephron is the functional unit of the kidney, and the filtration, the ultrafiltration occurs in the glomerulus in each and every nephron. And coming to the functions of the kidney, so it maintains the fluid balance, the fluid homeostasis is maintained by aldosterone and ADH, and it helps in the removal of waste products from the blood. We know the removal of the waste products occurs through kidneys. It occurs by ultrafiltration in the glomerulus especially, and apart from that by reabsorption in the tubules. And the other function is maintaining normal blood pressure by balancing electrolytes such as sodium and potassium. So it maintains the sodium and potassium by reabsorption in the renal tubules. And the other important function is regulating bone mineralization. The mineralization, demineralization is maintained. The mineralization is maintained by kidneys by maintaining the calcium levels, calcium homeostasis. Okay, so these are the important functions of kidney. And coming to the function test of kidney, to assess the functioning of the kidney, it can be divided into the urine analysis, the blood examination, glomerular function, and tubular function. So separately, the glomerular function is nothing but filtration, and the tubular function is nothing but reabsorption. So this urine analysis is a broad assessment of kidney, and blood examination is also a generalized examination, and glomerular function is to assess the glomerular function, that is filtration functioning of the kidney, and tubular function, that is reabsorption functioning of the kidney, is assessed by different tests. Okay, so these all combinedly assess the complete functioning of the kidney. Coming to the urine analysis, it is divided into physical examination, the biochemical examination, and microscopic examination. Physical examination is also known as macroscopic examination. So in macroscopic or physical examination, we will be seeing the volume, order, appearance, pH, specific gravity, all these we will be seeing, because the variation in the physical characters sometimes denote some diseases. Okay? For example, if the volume is increased, polyuria, so that can be seen, that is more than 2500 ml per day. So normally 1500 ml per day is the, in between 1500 to 200 is the 2000 ml per day is the normal. So normally we will be taking 1500 ml per day is an average. So if there is polyuria, that is more than 2500 ml per day, then we can suspect some diabetes mellitus or diabetes insipidus or chronic glomerulonephritis. Similarly, if there is less amount of urine, less than 500 ml per day, then we can suspect some other diseases like early stages of glomerulonephritis and cardiac failure, and acute conditions like fever and diarrhea. Okay? So this is the physical examination. And pH also, acidic pH generally it is acidic. Alkaline pH of urine can be seen in urinary tract infections, and foul odor can be seen in bacterial infections. So this is all the macroscopic or physical examination of the urine, which is a basic part in the renal function tests. And coming to the microscopic, we'll be seeing the red blood cells, white blood cells, and different casts in the microscopic examination. This microscopic examination in detail will be seen in your next academic years. And coming to the biochemistry, the biochemical examination. The commonly we will be seeing the glucose and protein, glycosuria and proteinuria. Okay? And depending upon the amount of protein, it can be classified as benign, pathological, and glomerular proteinuria, or mild, moderate, and severe proteinuria that we had seen in the practical sessions, and microalbuminuria can be assessed. So all these can be subclassified by seeing the amount of protein excreted in the urine by proteinuria, and also excretion of glucose can also be seen in abnormal conditions. Okay. And how we will see the glucose and protein in the urine, all this we had seen in the practical session. Okay, by the chemi-strip and multi-strip we can assess the semi-quantitative estimation of excretion of glucose and protein in the urine, +1, +2, +3, and +4. Okay, by that we can assess the approximate amount, or semi-quantitatively we can assess the amount of excreted glucose or protein. This is about the urine examination in renal function test. Coming to the blood examination, commonly the urea, creatinine, and electrolytes like sodium, potassium, and chloride are estimated in blood examination of renal function tests, because the urea and creatinine are excreted through kidney only, and the reabsorption of the electrolytes takes place in the renal tubules. So these are commonly estimated in case of renal function test. And all the normal values and what are the methods for estimation of urea, creatinine, all this you had seen in the theory and also in the practicals also. You had estimated the urea, you had estimated the creatinine by using different methods. Okay, dam method and alkaline picrate method. By this you had estimated. And you had already seen in how these are estimated in the semi-auto analyzer and fully auto analyzer. And you had already seen how these electrolytes are estimated in the electrolyte analyzer. And you had also seen the normal values. Okay, so these are all constitute a part of renal function test. And coming to the estimation of glomerular function of the liver, that is filtration function of the liver, kidney, glomerular function of the kidney or filtration function of the kidney. So that is assessed by renal clearance test. So what are these clearance tests? The renal clearance of a substance is defined as the volume of plasma from which the substance is completely cleared by the kidneys per unit time or minute. Okay, and this clearance test depends upon the plasma concentration of substance, GFR, the glomerular filtration rate, and renal plasma flow. So depending upon these factors, the clearance test depends. So these clearance tests are estimated by a formula, that is C is equal to U into V by P, where C is clearance of the substance and U is concentration of substance in urine, and P is concentration of substance in plasma, and the V is volume of urine passed per minute. Okay, so this is the calculation of clearance, the amount of clearance, okay, which in turn helps in estimation of glomerular function of the kidney. So coming to the creatinine clearance, the creatinine clearance is determined by collecting urine over 24 hours. A sample of blood is drawn during the urine collection period, and creatinine clearance is estimated with the same formula, U into V by P. So there can be urea clearance, or there can be the inulin clearance. Different types of clearance are there. So all these are renal clearance tests which are useful in assessing the glomerular function of the kidney. And this GFR, it depends on the GFR, and the GFR is estimated by Cockcroft-Gault formula. This is the formula which is designed for estimating the GFR, and the renal clearance depends upon the GFR. Okay. And coming to the assessing the tubular functions of kidney. So the tubular function is nothing but reabsorption function of the kidney is assessed by PSK excretion test. Okay. The phenol sulfatylene excretion test. It is a dye. It is given to the patient, and after that, it is estimated in the urine. If the excretion is less than 23% of the dye during the period, if the amount excretes in 2 hours, it indicates impaired renal function. Okay, if it is less than 23%. So this is the test which is useful for assessing the tubular function of kidney or reabsorption function of the kidney. Because most of the biochemical substances after undergoing the filtration, they will be excreted. So before excretion, some part of the biochemical substances are reabsorbed by the kidneys. So that is important function of the kidney. So this is the renal function test. Okay. Now we will be assessing the urine, we will be assessing the blood examination, and we will dividedly we will assess the glomerular function, the filtration function, and the tubular function, the reabsorption function. And next coming to the gastric function test. And when these renal function tests are done, what are the indications? Same indications, in generalized indications. Okay, if we see any symptom, if we suspect any disease of a kidney, or during any screening, generally screening for renal function, for renal diseases is very common. Okay, so in case of any screening or in case of any follow-up of the treatment, in all these cases, the renal function tests are done. Coming to the gastric function test. So we know the normal anatomy of the stomach. Okay, after esophagus, we will be having stomach. We will be having fundus, body, and the pylorus, and it is connected to the duodenum. And coming to the functions, a reservoir of ingested food. So the food that will takes place will remain in the stomach for some time for being digested and being absorbed. Okay, for moving into the intestine and for being absorbed, for sometimes it stays in the stomach. So it acts as reservoir of the ingested food stuff. Mixing of food with gastric secretion until it forms a semi-fluid mixture, which is known as chyme. Okay, so it helps in the by the gastric movements. It helps in the mixing of the food stuff, the food contents with the gastric secretions, which is necessary for the digestion. And the next is secrete substances which are responsible for initiation of the digestion. We know most of the food nutrients, the macronutrients that we take, the carbohydrates, lipids or proteins will remain in the stomach. Only the little amount of digestion takes part in the stomach. Okay, most of the digestion absorption takes place in the intestines, duodenum, ileum. Okay, only some part of digestion takes place in the stomach. So initiation of digestion takes place in the stomach. So stomach is very much necessary for initiation of the digestion, which is required for the absorption and for different functions in the further track of the nutrients. Indications of gastric function test. Of course, if you suspect any disease or for screening also gastric function test can be done, but most commonly gastric function test is done for exclusion of diagnosis of pernicious anemia and the diagnosis of Zollinger-Ellison syndrome. That is the most common indication for the gastric function test, and also for determination of completeness of surgical vagotomy. In case of surgical vagotomy, whether the surgical process is success or not, to see that we will do the gastric function test. And coming to the test, the gastric function test, it's also divided for comfort's sake. The examination of resting contents and the fractional test meal, examination of contents after stimulation, and the stimulation can be done by alcohol, by caffeine, histamine, augmented histamine, inulin stimulation, and pentagastric. So by stimulation is done by giving different stimulants to the stomach and tubeless gastric analysis. Okay. So in all these stimulation tests, the gastric contents are collected before stimulation and they are assessed, and the gastric contents are collected after stimulation and they are assessed. And in after stimulation also, they can be collected for every 15 minutes or every half an hour depending upon the stimulation test. Okay. In the first one, coming to the examination of the resting contents. So the volume, the normal volume is 20 to 50 ml, and abnormal it can be greater than 100 to 120 ml. And consistency, normally it is fluid in consistency, and we will see any abnormality, maybe any food residues or any other substance is present in the gastric juice or not. Okay, that is about the examination of resting contents. And the second one is fractional gastric analysis or fractional test meal. So how these gastric contents are collected? By introduction of the Ryle's tube. In the previous session also we had seen, while dealing with the analysis of different body fluids, we had seen that the Ryle's tube or the nasogastric tube is introduced to the nostrils and it is sent to the stomach. Okay, and from there we'll to the other end we'll be drawing the gastric contents by syringe. So all this we have seen. So introduction of Ryle's tube in stomach of fasting patient, removal of residual gastric contents and its analysis. The gastric contents are taken out and it is analyzed. Mostly the gastric contents are analyzed for acidity, HCl. And ingestion of the test meal. After taking the fasting gastric contents, then ingestion of test meal is done and then analysis of the sample. After ingesting the test meal, after sometimes again through the syringe, through the Ryle's tube, the gastric content is collected and again it is analyzed. So this is fractional gastric analysis. And stimulation test, we know different stimulants are given. The first one is the alcohol stimulation test. Overnight fast, Ryle's tube is passed and resting contents are removed and analyzed. So all the resting contents, so in all the stimulation tests, the resting contents are analyzed. 100 ml of 7% ethyl alcohol is administered and the samples removed for every 15 minutes and analyzed for free and total STD. And it's also analyzed for presence of any bile, blood or any mucus in the gastric fluid. And augmented histamine. Okay, generally 10 milliequivalents per hour acid is present in pre-histamine specimen and with 10 to 25 milliequivalents in post-histamine specimen in a normal patient. In an abnormal patient, sometimes there will be absence of the HCl and sometimes there will be greater than 100 milliequivalents in some conditions. Okay. See, for example, in pernicious anemia, the HCl, no free HCl is secreted, and in duodenal ulcer, sometimes more than 100 milliequivalents can be secreted, whereas the normal is 10 milliequivalents per hour. Okay, because the duodenal ulcer most commonly it is caused due to excessive secretion of the acids only. So that's why for determining the pernicious anemia and duodenal ulcer, this augmented histamine test is very important. And all this process, all this you know, how we will be doing the augmented histamine test. And insulin stimulation test, Hollander test, the potent stimulus for gastric acid secretion. It may lead to hypoglycemia also. The main indication is to see the completeness of the vagotomy. The vagotomy is a surgery which is done in the patients, in chronic duodenal ulcer patients, the vagotomy is done to decrease the acid secretion in the stomach. So whether to check whether this vagotomy is successful, whether it is complete or not, this Hollander test is done. Okay. So 15 units of soluble insulin can be given as stimulus. So this is also a stimulation test, gastric stimulation test, which is done most commonly in case of vagotomy to check whether it is complete or not. So coming to the normal basal secretion, it is 1 to 2.5 milliequivalents per hour, and the maximal is 20 to 40 milliequivalents per hour. So in duodenal ulcer, it will be above the maximal secretion, because the basic defect in the duodenal ulcer is excessive secretion of the acid itself. And in case of cancer and pernicious anemia, it can be absent. Okay, less than 1 or sometimes it can be absent. So coming to the tubeless gastric analysis, this what is done is, main thing you have to remember is cation exchange resin is given orally to the patient. The ions liberated at pH less than 3 only. So when this cation exchange resin is given, the ions are not liberated at anywhere in the GIT, because only the pH is less than 3 in stomach only. So that's it. The ions are released only in stomach. So the cation exchange HCl is excreted in the urine. So these cations, the ions which are released, combines with the HCl. Okay, the ions which are released from the cation combines with the HCl, and these are excreted in the urine. So it gives an indirect measure for acid secretion. Okay. So how much acid is present, that much of ions combined with the HCl. So that is excreted in the urine. So in urine, we will estimate the ion HCl concentration. Okay, this is cation HCl. So in these ions are released only in the stomach. So that's it. We can assess in the urine and estimate the HCl. So it is an indirect measure of acid secretion in the stomach. This is known as tubeless gastric analysis, because without introducing any Ryle's tube, whereas in the previous tests which we had seen in the gastric function test, in all those the tube is necessary, right? The introduction of Ryle's tube is necessary, but tubeless gastric analysis is a test without Ryle's tube. An exchange, a cation exchange is given orally. Okay, that will go into the stomach, and only at that pH only the cation exchange will release the ions, and these ions will combine with the HCl present in the stomach, and when it is excreted in the urine, we can estimate the amount of ions released in the stomach. Depending upon the ions, we can assess the acid secretion in the stomach. Okay, this is tubeless gastric analysis. So all these function tests are for assessing the function of the organ, and mainly for the diagnosis of the disease only. Diagnosis of the disease, and to see the damage to the particular organ, and to assess the severity of the disease, and to see the prognosis of the disease, and to give the follow-up of the disease after treatment. For all these things, these function tests are necessary. And next is the pancreatic function tests. So we know the pancreas is an organ which is having different lobules, and it is divided into head, body, and tail. And pancreatic duct will be there, and all those things you know. And coming to the functions of the pancreas, endocrine and exocrine functions. The endocrine functions, the release of hormones, which include insulin, glucagon, and the exocrine function of the pancreas is very important, which releases different enzymes like amylase, proteases, and lipase. So the pancreatic function test can be divided into tests for diagnosing the exocrine pancreas and exocrine pancreatic insufficiency. Okay. So endocrine function, insulin and glucagon, that is not commonly estimated in pancreatic function test, but the exocrine function of pancreas is commonly done. Okay, and it is further divided into diseases of exocrine pancreas and exocrine pancreatic insufficiency. So coming to the exocrine pancreatic test, serum amylase, serum lipase, and sweat test are done. So serum amylase is a digestive enzyme since in the pancreas and the salivary glands. Most of the amylase present in circulation is of pancreatic origin. And in acute pancreatitis, the amylase leaks into circulation from the damaged cells. Serum amylase is useful in acute pancreatitis because it is increased greatly in acute pancreatitis. A smaller increase occurs in acute pancreatitis also. Okay, so we'll estimate the amylase. If the amylase is more folds, it is increased, then we can suspect it is acute pancreatitis. Because in acute pancreatitis, there will be destruction of the pancreatic cells, there will be damage, and all the contents are released into the bloodstream. So the amylase, which is already present in the pancreatic cells, will be released into the bloodstream. So that's why the estimation of amylase in blood reveals the increased amylase levels in case of acute pancreatitis. And coming to the serum lipase, is another digestive enzyme since in the pancreas. It leaks into circulation from damaged pancreatic cells in acute pancreatitis, and serum lipase is also increased in acute pancreatitis. Okay. But one thing you have to remember here is amylase can be secreted from other organs apart from pancreas, but lipase is secreted in pancreas only. It is more specific for pancreas. Estimation of lipase is more specific for pancreas, and estimation of amylase is more sensitive for the pancreatitis. And sweat chloride, this we had seen in previous session while seeing the estimation of different body fluids. So sweat chloride is very much necessary for estimation of cystic fibrosis. Okay. So cystic fibrosis, fibrocystic disease of pancreas, or mucoviscidosis. So this can be diagnosed by estimating the chloride in the sweat. Okay. And exocrine pancreatic insufficiency, the most common cause chronic pancreatitis, is also cystic fibrosis. So this can be assessed by direct and indirect tests. So direct test is oroduodenal intubation is done to aspirate pancreatic secretion from duodenum near ampulla of Vater. Okay. So they are analyzed. And secretin or cholecystokinin, or both can be used. Okay. Pancreatic juice is collected generally for 40 to 125 minutes. Coming to indirect test, measurement of fecal fat and measurement of fecal elastase. This helps in the estimation. It's an indirect test for exocrine pancreatic insufficiency. And coming to the thyroid function tests, the thyroid is an organ, you know, which is divided into lobes and connected by the isthmus. And coming to the functions of thyroid gland, the functions depend upon the T3 and T4, the thyroid hormones, which help in the metabolism, growth and development, and all other different functions. And you know the feedback mechanism of control of T3 and T4. T3 and T4 produced by stimulation by TSH, which is produced from pituitary, and which is controlled by TRH, which is produced from hypothalamus. So all this. So coming to the introduction, the T3 and T4 are the most important thyroid hormones which are necessary for thyroid function test. And apart from that, thyroxine binding globin, thyroxine binding prealbumin, and apoproteins albumin all can be assessed. And thyroid tests measure the concentration of products secreted by thyroid gland, evaluate the integrity of hypothalamic pituitary thyroid axis, and assess inherent thyroid gland function, and detect antibodies to the thyroid tissue. Sometimes antibodies can also damage the thyroid glands, which lead to hypothyroidism. So this can be detected by assessing the antibodies, autoantibodies. So the thyroid function tests, most commonly done tests are T3, T4, and TSH. Apart from that, FT3 and FT4, free T3 and free T4, which are nothing but which are not T3 and T4, the part of T3 and T4 which are not bound to any proteins, that is known as FT3 and FT4. Okay, these are the commonly done tests. And thyroid test, T3 normal range, there are different normal range, you can follow any text. This is used for detect T3 thyrotoxicosis. And T4, the normal range are different in different books, you can follow in a standard book, and measures both bound and FT4, and it is increased in hyperthyroidism. and decreased in the hypothyroidism. And FT3 and FT4 are also measured, and same thing, FT3, FT4 are increase in hyperthyroidism and decrease in the hypothyroidism. And what are the normal ranges and what are the method of estimation? All these we have seen in the previous sessions. And TSH is also very important because initially in hypothyroidism, first the TSH levels will be increased. We can't see any difference in T3 and T4. They will be normal. The increase in the TSH levels are initially seen in the hypothyroidism. Okay, and we can see whether it is symptomatic or asymptomatic hypothyroidism or it is primary hyperthyroidism. Okay, say in asymptomatic the TSH will be increased to some extent, and in symptomatic hypothyroidism it is increases more than 20, and in hyperthyroidism it will be decreased. In hyperthyroidism, the T3 and T4 are increased and TSH is decreased. And it regulates TRH, it regulates the TSH for secretion from pituitary, we know that. And TRH test measure the ability of TRH to stimulate the pituitary to secrete TSH. And TSH rise of 5 microunits per ml over baseline can be considered as euthyroid state. A significant increase rules out hyperthyroidism. And to evaluate the integrity of hypothalamic pituitary thyroid axis, assessment of both TSH and TRH simultaneously is necessary. Okay, to assess whether the defect is in the thyroid gland or the defect is in the pituitary gland or the defect is in the hypothalamus. To know this, combinedly the measurement of T3, T4, TSH and TRH is done. Okay, this is hypothalamic pituitary thyroid axis. And antibodies. So apart from this, detect antibodies to thyroid tissues, some due to some genetical defect. Sometimes auto antibodies can be produced which destroy the thyroid gland inside the body. Okay, within the body these antibodies are formed and the thyroid gland is destructed. So found in Hashimoto's thyroiditis and Graves' disease. Okay, and adults without thyroid disease, 10% of them. In Graves' disease, the hyperthyroidism is caused by antibodies activating TSH receptors. And in thyroiditis, hypothyroidism is caused by antibodies competitively binding to TSH receptors, thus blocking the TSH from eliciting the response, which leads to decreased T3 and T4. So thyroid disorders, the common thyroid disorders are hypothyroidism and hyperthyroidism. And apart from this, the thyrotoxicosis, the Graves' disease, myxedema, cretinism, all these we had seen in the previous session. But the basic disorders of thyroid diseases are hypothyroidism and hyperthyroidism. In hypothyroidism, the T3 and T4 will be decreased and TSH will be increased. And in hyperthyroidism, the T3 and T4 will be increased and TSH will be decreased. And hypothyroidism, it can be asymptomatic and symptomatic, and that means it can be primary, secondary, and tertiary. Okay. So coming to the summary, in hypothyroidism, T3, T4, FT3, FT4 all are decreased, and in hyperthyroidism, T3, T4, FT3 all are increased. Okay. And TSH, coming to TSH, in hypothyroidism, the TSH will be increased in the initial stages, but in the latter stages, in the chronic disease, after a long time, the TSH can be decreased after that, because initially it will be increased to increase the T3 and T4, but finally it will be decreased. And coming to the hyperthyroidism, the TSH will be decreased very fast. Okay, so this is the summary for thyroid function tests. And in other diseases also there will be variation of the T3, T4 and TSH. So this is the organ function test. So organ function test to assess the functioning of the organ, to diagnose the disease, to assess the severity of the disease, to see the prognosis of the disease and to follow up the treatment of the disease. And also they will be useful for the screening. These organ function tests are set of tests. Each organ will be having a number of functions. So all the functions are assessed with different tests. So all these different tests are combined to form a set of tests which are known as organ function tests. Okay. So hope everyone understood. So thank you and all the best.